number 20 on international trade. Today's meeting is taking place in a hybrid format pursuant to House Order of June 23, 2022, and
Check 1, 2, 3.
Therefore, members are attending in person in the room and remotely using the Zoom application. I would like to make a few comments for the benefit of witnesses and members that I have to repeat every single meeting. Please wait until I recognize you by name before speaking. When speaking, please speak slowly and clearly. For those participating by video conference, click on the microphone icon to activate your mic, and please mute yourself when you are not speaking. With regard to interpretation, for those on Zoom, you have the choice at the bottom of your screen of either floor, English, or French. For those in the room, you can use the earpiece and select your desired channel. A reminder that all comments should be addressed through the chair. For members in the room, if you wish to speak, please raise your hand. For members on Zoom, please use the raise hand function. The clerk and I will manage the speaking order as best we can, and we appreciate your patience and understanding in this regard. Should any technical challenges arise, please advise me, and we'll suspend for a few minutes in order to ensure that all members participate fully. Pursuant to Standing Order 1082 and the motion adopted by the committee on June 6, 2022, the committee is beginning its study of potential impacts of the ArrivaCAN application on certain Canadian sectors. And we have with us today, as an individual, Zain Chagla by video conference. From the Canadian Airports Council, Monette Pasher, President. From the City of Niagara Falls, Jim Dodati, the Mayor. From the Tourism Industry Association of Canada, Beth Potter, President and Chief Executive Officer. And from the Vancouver Airport Authority, Trevor Boudreau, Manager Government Relations. Welcome to you all, and thank you very much for taking time out of your busy schedules to join us both in person and by video conference. Dr. Chagla, I invite you to make an opening statement of up to 5 minutes, please.
Everyone, and good morning. Thanks for allowing me to appear as a witness before the Standing Committee on International Trade study of the potential impacts of the ArrivaCAN application on certain Canadian sectors. My name is Zain Chagla. I'm an infectious disease physician, medical director of infection control at St. Joe's, and an associate professor at McMaster University, both in Hamilton, Ontario. Throughout the pandemic, I've worked with COVID-19 infection control, vaccinations, therapeutics, local epidemiology, clinical trials, and public education. I'm a frontline physician, still see up to 50 patients a week with COVID-19 to offer them early therapy. Today's meeting focuses on the impact of ArrivaCAN, and while my focus today is not on the application per se, but why these measures were needed that were instilled within ArrivaCAN, and when the need for them started to decrease. This is important because the need for the application was predicated on the need for certain travel measures throughout the pandemic. Canada has used several travel measures, including pre- and post-arrival testing, quarantine of various groups, proof of vaccination when vaccinations became available. At the beginning of the pandemic, it was increasingly apparent that international travel was leading to ongoing transmission within Canada, whether it be through international flights or through the land border of the United States. And, you know, in the first year of the pandemic, with fairly limited options to reduce transmission and subsequent healthcare utilization, and the background of ongoing local restrictions to limit transmission, the use of these travel measures did make sense. However, you know, following the introduction of vaccinations, the data suggested a marked reduction in transmission and infection, and a significant decrease in severe complications in vaccinated individuals, marking a time where long-term sustainability with vaccinations and eventual therapeutics may have led to a rethink of pandemic measures. And particularly when Omicron emerged, many things changed. Vaccination efficacy still remained quite high with severe disease, but with 2 doses decreased significantly, with data even from Ontario suggesting very limited protection 20 plus weeks after that vaccine dose was administered, which really impacted the use of a proof of vaccination policy to limit transmission associated with travel. One could argue such a mandate was important to reduce severe disease in travelers, as the vaccines still remain an important measure for that. But we do know the distribution of severe disease is uneven, and an unvaccinated 12-year-old still presents a significant lower risk of hospitalization than a fully vaccinated 80-year-old with available boosters. Adding to this, the use of quarantine and border measures was also challenged. PCR testing, which was used earlier in the pandemic, is expensive and carries the risk of identifying low risk or asymptomatic individuals with a prior infection, as they may shed non-viable virus for weeks and even months after that infection. This became magnified in the era of Omicron, particularly when many provinces limited access to PCR testing for the general public. And so many individuals may not have been able to document their prior infection with a PCR test, thereby increasing the risk of an individual identified for random testing positive while posing no threat to the local community and having to undergo quarantine. The use of random testing with variants was important, but as a secondary benefit, but there were other methods of surveillance with the ability to do local surveillance and sequencing to improve our variant maps across the country, and global data sharing, which allowed for many countries to share this data transparently, underlying again the collaborations that allowed for us to examine variants of concern without using the international border as a method to do that. And the reality is all variants of concern eventually did reach Canada with the Omicron subvariants currently circulating. Finally, the use of quarantine in asymptomatic individuals, again in the Omicron era, in the context of wide-scale community transmission, was really of limited community benefit, recognizing that chains of transmission were far more likely to occur domestically than they were with international travel or travel over an international border. The lack of benefit was also magnified over the land border, where shorter and same-day travel, personal vehicles, a single country with very transparent access to variant data made less rationale to employ these measures at the land border. A modeling study by IATA looked at what the impact of measures would be in terms of testing and quarantine in a number of different scenarios, such as an Omicron emergence or a vaccine emergence. And across a number of different modeling scenarios, they saw a 2 to 4 day delay of the peak of infections, with largely the same peak of infections noted in local communities. So yes, these measures, if instituted appropriately and 100%, may work, but all they may do is delay the peak, not necessarily delay the amount of infections, but delay when they occur.
Dr. Shagla, thank you so much. I'm sorry, the time is up and we must move on. Thank you very much for that information. Ms. Pasher, please, for up to 5 minutes, please.
Thank you. Thank you, Speaker. Good day, committee members. My name is Minette Pasher, and I'm the president of Canada's Airport Council. I'm pleased to appear before you today on behalf of our members, Canada's airports, and speak to your study on the impacts of the ArriveCAN app. Before I begin, I would like to acknowledge that I join you today on the unceded territory of the Anishinaabe Algonquin Nation. Like so many sectors, we are focused on learning the lessons learned from the pandemic and leveraging tools to support more efficient travel. Part of that means finding ways to innovate and to create a streamlined process for passengers in Canada's airports as we see the return to travel. Canada's airports have long advocated for tools that create efficiencies at our border without compromising their integrity of our national security. Over our history, the airport sector has welcomed measures like border pre-clearance agreements and the Nexus program, which have helped streamline the travel experience for passengers. We know that achieving greater efficiencies with border processing means deploying new technology solutions. From the perspective of our members, digital tools must in fact be the cornerstone of the future of air travel. To that end, ArriveCAN can be part of the solution rather than the problem, but only if it's used correctly. It is important to distinguish between the application itself and its use to manage the impacts of the pandemic. Now, with the inclusion of the advanced declaration within ArriveCAN, we have taken the first step down the path of using technology to support low-risk travelers. As many of you heard publicly from our members over the last several months, our sector had been advocating for all COVID-19 health checks and testing to be removed, as visitors were choosing not to come to Canada because of potentially being required to quarantine for 14 days. As of Saturday, these policies have officially changed, which we very much welcome and appreciate. But fusing public health checks with the customs process has unfortunately shrouded the true benefits that this technology can deliver both to our passengers and our airports. When used to allow passengers to accomplish in advance via the application what they have been traditionally been required to do at a kiosk in our airports, this tool presents a tremendous opportunity. There are notable benefits to moving away from using ArriveCAN for public health checks, but rather using it as a tool to streamline existing border processes, which it must be noted was the intended purpose behind creating the platform in the first place. Passengers can now complete their advanced declaration using ArriveCAN up to 72 hours in advance at some of our airports. For travelers, this cuts down total processing time by more than half. That is quantifiable. It's measurable improvement in processing times. That feature benefits travelers who choose to use the platform, but also shrinks wait times for all travelers in line, whether they choose to use the app or the traditional route. So it helps get everyone to their destination more quickly. Our borders are essential to both our safety and to our security. Getting travelers across those boundaries more quickly does not require sacrificing either one. It simply requires us to use our resources practically and correctly to offer new and more sophisticated ways of accomplishing the same goals. Technology is key to that. And we ask our government leaders and our stakeholder partners to remain focused on working collaboratively with us so we can deploy and implement those important tools. Rather than disregarding ArriveCAN, we should take stock of how it can be used best. The result from the advanced declaration function proves the value of doing just that. Now we need the legislative and regulatory authority under the Customs Act to fully modernize our border. We will continue to be a partner in making the right investments and decisions to help reduce processing times. It is what travelers expect. Thank you for your time, and I look forward to the discussion.
Thank you very much. On to Mayor Diodati for 5 minutes, please.
Thank you very much to the committee, and I'll do my best to not repeat, but Niagara Falls is the #1 leisure destination in Canada. We get upwards of 20 million visits per year. 40,000 people count on tourism to feed their families, to pay their mortgage, to pay their bills. So COVID has been devastating on us. Tourism is a $105 billion export industry in this country, and it's affected Niagara Falls as a tourist community to the tune of billions of dollars. And I've submitted documentation from Niagara Falls Tourism, from the Peace Bridge Authority, and also from the Niagara Parks Commission to further illustrate the impact that it's had on us here. And to illustrate to the group the amount of people that come here, we get approximately 10 million crossings of our 4 international bridges. The majority of people that come into this country do so at land border crossings. And oftentimes it's what we refer to, it's the rubber tire market. People impulsively make a decision to come to Niagara Falls. The typical scenario is a family wakes up, the weather is nice, they make a decision at breakfast to drive to Niagara Falls. They get in the van, they get to the border, they're questioned about the ArriveCAN app, of course, most of which have no idea what they're talking about. So they're asked to download it and oftentimes do not have roaming. Certainly most times do not have access to Wi-Fi at the border. And then our CBSA border guards, instead of worrying about drugs and guns and criminals, become administrators, helping them to download the app with questionable outcomes, and especially I don't need to explain the glitchiness and the problems that we've experienced with it. What happens, these people get very frustrated. And as we often say, when you have an experience that's good, you tell someone, and when it's bad, you tell 10 people. And that's exactly what's been happening. There's been very much a lot of negativity through the US media and the word of mouth that's traveling throughout the United States. And now many people have decided to bypass Canada with their leisure dollars. And our bigger concern now going forward is the long-term residual effect of the negativity around our borders. So we're going to be looking for our federal and provincial governments to work together to help us to fund a campaign to help get the word out that we've now removed these unnecessary requirements at our borders and once again are open for business. Our ultimate goal, of course, always was to be safe. And early on, we supported all the border measures to keep our communities safe. And as Dr. Zane Chagla illustrated, there came a point when it wasn't doing that any longer. And we were hopeful that at the beginning of the tourism season, that these measures would be lifted so that we'd have a chance for a recovery. Typically 50% of the revenue that comes into Niagara Falls, that's 50, comes from US visitation. Americans typically stay longer and they spend more. So the long-term effect of this requirement at the border has been devastating. So now, unfortunately, the tourism season is over and 80% of our revenue comes in during the summer. Now we're in what's known as the shoulder season, and we'll be going into the holiday season. The tourism operators in Niagara Falls need to make enough revenue during the summer to carry them through the shoulder season and through the winter until the next season is upon us. So we were very hopeful that tourism would return this year. And I will say the good news is domestic tourism returned to pre-pandemic levels and beyond. So clearly people were ready to return. But unfortunately, US visitation was approximately half of pre-pandemic numbers. We point our finger squarely at the border measures, including the ArriveCAN. So we've got a lot of businesses right now that are trying to figure out how they're going to pay their bills going into the shoulder season. And we're hopeful, we're grateful, first of all, that it's been removed. And we're hopeful that the federal government will work with the provinces and help us come up with an advertising campaign. I've suggested a grand reopening of Canada right here in Niagara Falls with the Prime Minister and the premiers, that we could let the Americans know that once again, we are open for business. That's all I have at this time. Thank you very much.
Thank you very much, Mayor Donati. Ms. Potter, please.
Madame la Présidente et chers membres du comité, j'aimerais vous remercier de m'avoir invité.
I would like to thank you for inviting me today. My name is Beth Potter, and I'm the President and the CEO of the Tourism Industry Association of Canada. I will make my remarks in English, but I will be pleased to answer your questions in French during the question period.
I acknowledge that we are gathered here today on the unceded and unsurrendered territories of the Anishinaabe Algonquin Nation. TIAC is the national advocate for tourism in Canada. Acting on behalf of thousands of businesses across the country, our work involves promoting policies, programs, and other initiatives that foster the growth of the sector. Tourism matters. It enables social, economic development, job creation, and poverty reduction. This in turn drives prosperity and has a significant positive social impact, providing unique opportunities to women, minorities, and young people. And the benefits of travel and tourism spread far beyond its direct GDP impact and employment, with indirect gains extending through the entire travel ecosystem and supply chains to other sectors. I would highlight also that tourism plays an important role as head ambassador on the global stage in sharing Canada's values and principles, and is a crucial vehicle for fostering social cohesion. As I shared with you during my last appearance, the multitude of restrictions that were put in place during the pandemic to keep Canadians safe, including border closures and lockdowns, had a devastating impact on the tourism industry. I also shared with you that as our hard work continues to recover from the pandemic, we now face new challenges: disruptions in supply chain, inflation at a 40-year high, rising interest rates, and a severe labor shortage, to name a few. We are still a very long way from recovering Canada's travel economy to its former glory. The latest forecast estimates that total tourism spending in Canada is now tracking to return to pre-pandemic levels by 2025. In fact, those estimates forecast total spending levels from both domestic and international sources to reach $80 billion by the end of this December. That's 24% lower from our pre-pandemic high water mark. Domestic spending is expected to recover much quicker than the international market, but it's still down 16%, and international spending is down 53% compared to 2019. The international market is important to consider and actively promote. This is because foreign tourists tend to travel longer when they come to Canada, and they tend to spend more per trip. When I last spoke with you, we were hopeful to see a significant resurgence in tourism this summer. We know that people want to travel, and we know there is considerable pent-up demand to get out there and experience all that Canada has to offer. So I'm pleased to share with you that this summer season has certainly been better than the last 2 years, and there is hope for optimism. We are particularly grateful to Minister Boissonnault's leadership in launching the important process of updating Canada's tourism growth strategy. This initiative is intended to result in a comprehensive action plan to help the Canadian tourism industry rebuild from the impact of the pandemic and best position it for future growth and success. In our submission, which we tabled in early August, we outlined key priorities to help the tourism sector build forward to the economic powerhouse that it once was. We recommended that a number of key targets be achieved by 2030. These relate to tourism spending, dispersion, workforce, international overnight visitors, and our global competitive position. Critical to the success of the new federal strategy, we also highlighted the need for all tourism partners across the whole of government to work towards the same goals. In this regard, we recommended the creation of a Tourism Policy Council of Ministers led by the Minister of Tourism to ensure tourism is prioritized across federal departments and decision-making is aligned. We also identified 4 key pillars that would best underpin the new strategy. These are attract and retain a sustainable tourism workforce, improve access for visitors to and within Canada, develop and promote tourism assets, and build a regenerative and inclusive tourism industry. We emphasize that tourism is a broad ecosystem, a complex value chain that will only ever be as strong as its weakest link. Therefore, the new strategy and the measures it entails must take this reality into consideration, must be comprehensive, and must seek to bolster as much as possible each of these important links. With a new comprehensive and effective strategy in place, we are optimistic that the tourism industry's potential to not only recover to pre-pandemic levels in the next few years, but to return to the annual growth performance it was achieving up until 2020. This, we further contend, will only be possible if private and public sector partners continue to work together and the right tools and measures are put in place. So you might not be surprised to hear me say that we fully welcomed the government's decision early last week to remove all remaining COVID entry restrictions, testing, quarantine, and isolation requirements for anyone entering Canada, and to lift the mandatory masking requirements. And in closing, I note that we are happy the ArriveCAN app will henceforth become a voluntary tool to help streamline the customs process. I am far from convinced that it was an effective tool for controlling the entry and spread of COVID, and I know how much it caused problems for travelers and for tourism businesses. Je vous remercie. Thank you very much.
Thank you.
Very much, Ms. Potter. Mr. Boudreau for 5 minutes, please.
Thank you, Madam Chair, and bonjour à tous. I'm grateful to be joining you today from my office here at YVR, which is located on the traditional and unceded territory of the Musqueam people, and I pay my respects to elders past and present. On behalf of Vancouver Airport Authority, we appreciate the opportunity to present to the committee today. With the federal government removing the mandatory requirements for travelers to submit their personal health and vaccination information, we are pleased that we can now go back to focusing on the original intended purpose for ArriveCAN, and that is to support the continued modernization of Canada's customs processing, which benefits travelers, Canadians, and indeed the entire Canadian economy. YVR has had a long history of partnering with the federal government to innovate and modernize traveler processing, and I want to acknowledge and thank local CBSA staff, officers, and senior departmental officials for their ongoing collaboration over the years. In preparing for this appearance, I was looking at some old photos of our customs hall here at YVR, and I found one from 2005. It was a time when we were growing our passenger volumes exponentially, and we were deep in the throes of preparing to welcome the world for the 2010 Olympic Winter Games. At that time, it was a regular occurrence for the CBSA Customs Hall at YVR to be packed with passengers. Planes had to be held by gates, and passengers waited hours in lineups, as valuable customs officer time was spent reviewing administrative paperwork. Airlines that have connecting service to YVR were actively looking to divert to other US airports and away from YVR completely. Building our way out of that problem was not an option, and so we sat down with CBSA and in partnership looked at an innovative idea, one that combined ultra-efficient technology with live border official interaction. And the result was the launch of YVR's Border Express primary inspection kiosk in 2008. Today, as members of the committee likely know, these kiosks are widely used in airports and seaports around the world. In North America alone, these kiosks have safely processed over 250 million people without a security incident. Indeed, today, a customs officer at YVR can securely process a full A380 aircraft, that's 469 passengers, in about 20 minutes. So 15 years ago, kiosks revolutionized customs processing. Now we're here in 2022, and we believe the ArriveCAN platform will support the next natural evolutionary step in Canada's customs and border processing modernization. The optional the optional advanced declaration feature in ArriveCAN is a great example. Right now, it seamlessly integrates with existing kiosk technology in the Customs Hall, and that's thanks to another YVR CBSA partnership that occurred this past summer. Today, passengers who use that optional feature in ArriveCAN cut their time in an airport customs hall by half compared to those who do not. And that includes families that are arriving together, even when one or two of the loved ones may not be tech savvy or may not have access to a computer and need a little bit of help at the kiosk from their family member to complete their declaration when they arrive. But where we really see the benefit right now is in our international to domestic connections facility. Ms. Potter spoke about the importance of gaining greater access to tourism options, and this is doing it. Travelers can continue to use the ArriveCAN optional feature to submit their advanced declaration, have the peace of mind that they'll be able to make their connecting flight, even if they have a short layover here at YVR or at Toronto or at Montreal and soon many other airports across Canada. That's going to be really important for the millions of travelers that we're going to welcome through the winter months that need to quickly connect to another Canadian airport to experience our incredible tourism offerings in every part of the country. In the future, the ArriveCAN platform will help border officials to automate the recognition of individuals as the federal government expands its biometric requirements for travelers that apply for visas, work or study permits, as well as newcomers seeking to resettle here in Canada and contribute productively to Canada's economy. And so in closing, our ask is the same as that of Ms. Pascher's, and that is first, please stay focused on how ArriveCAN can be used to best modernize while keeping Canada's borders safe and secure. And second, continue to work collaboratively with the entire air sector on that journey of innovation and modernization. Thank you very much, and I look forward to the discussion.
Thank you very much to all the witnesses. I'll now open the floor for questions. Mr. Baldinelli for 6 minutes, please.
Thank you, Madam Chair, and thank you to all the witnesses for being with us this morning. My only regret is that we did not have the opportunity to have this meeting, say, several months earlier with ArriveCAN and those border restriction measures being lifted prior to our summer tourism season. I want to begin with Dr. Chagla, if I can. Thank you for joining us. On September 23rd, the Canadian Travel and Tourism Roundtable welcomed the release of a report called Evaluating Canada's Pandemic Border and Travel Policies, Lessons Learned. You were one of the authors of that study. And in the release, you're quoted as saying, "We've learned a lot since March 2020. It is no longer scientifically necessary or appropriate to use travel-related pandemic management tools almost 3 years after the start of COVID-19. Enough time has passed for us to make a scientific assessment as to whether the travel restrictions introduced by the federal government were successful in containing the spread of the virus and its variants. Just one question to you, Doctor. In your view, approximately when was it no longer necessary or appropriate to use travel-related pandemic management tools, such as ArriveCAN at the border?
Yeah, thanks for the question. Obviously, hindsight is 2020. I would say that, though, I mean, the data that we used to generate that report really was around the lack of efficacy around a vaccine mandate for preventing transmission, and that, you know, community transmission in local domains was much higher than what would be expected with travel. It became pretty apparent in spring of 2022 that that was the case. So, you know, I think much of our data, you know, focused even before then, where there may have been debate, but in spring of 2022, again, it was much more common and much more of the transmission was occurring domestically, that many of the restrictions domestically had been lifted, recognizing that, you know, many of the measures were not really making sense in that context. That, you know, similar in that the border, you know, the measures were likely not offering any significant benefit at that point either.
Thank you for appearing. And I was hoping if you could share a copy of that report for our committee, for our records, and the report that will be responsible for in a few weeks' time. I'd like to go to Mayor Diodati, and thank you for your presentation, Mayor. I know you've been aggressively advocating for the removal of hindrances that exist at our border crossings for many months. In fact, I believe the City of Niagara Falls even passed a resolution as early as May asking for ArriveCAN to be optional in many instances. And you talked about the impact on our city, but how badly was the City of Niagara Falls impacted? You talked about some information from Niagara Falls Tourism and the Niagara Parks Commission. I was wondering if you could quickly share some of that information.
Need to unmute, Mayor? Thank you.
Sorry about that. Thank you. Thank you for the question. Yeah, it's been hugely impactful and devastating. I mean, I'll just take one example, the Niagara Parks Commission. You know, they have over 1,100 employees, and typically 2/3 of the revenue comes from international, 2/3. And of course, the majority of that, you know, significant amount of that is U.S. visitations, call it what it is. They're our number one market, of course, anywhere in the world by far. So they were down over $1 billion lost. When I look at the bridge numbers, the delays, and, you know, we focus on good customer service, treat your customers well. The delays were 4 times what they should be because of the ArriveCAN, and that was with greatly reduced volume. So the customer service levels were very much lacking. And I'll tell you another impact, Mr. Baldinelli, it's senior citizens that live in these communities. And I was inundated with calls from these people saying they felt that they were being discriminated against because they were proud to show their passports, happy to show their vaccination status and boosters, but offended that they were being forced to do something they couldn't do. And we've got the statistics, but not to target seniors, but by and large, they're not as tech savvy as younger kids are. And a lot of them could not do the app because they didn't have smartphones, they didn't have computers. And I don't have to look any further than my father, who's 80 years old and has a flip phone. And him and my mom every Thursday, and this is what it's like living in a border community, we go over the river, and just like you would cross town wherever you live, and we go to visit our family and our friends, and it was disruptive to our family and our friends in addition to the revenue. And my dad and mom, every Thursday, they would go over the river, they'd go shopping, they'd visit some of their family and some of their friends, they'd go for dinner and come back. They haven't done that in 3 years, and they missed some very important and significant events, weddings, funerals, and otherwise. So I can tell you the seniors felt very, I guess, discriminated against because many of them do not have mastery of digital technology. So to say it's been devastating is an understatement, and to say that we're frustrated that we lost another tourism season to the international markets, we're looking for recovery. Thank you.
Thank you, Mayor Diodati. And a quick question to Ms. Potter. You were here in June, and at that time, I think during your presentation, you had talked about 10 million day trips by American visitors. Now, what's it going to take for us to get back to that figure? How long, and the impact of that American visitation that has on the Canadian tourism sector?
A brief answer, Ms. Potter.
We're expecting that it's going to take a number of years in order to get those numbers back up to where they were pre-pandemic.
Mr. Varani, please.
Thank you very much to all of the witnesses. Dr. Chagla, I enjoyed listening to you on the CBC. Thank you for your service. Mayor Diodati, I appreciated being in your jurisdiction for our caucus meetings this summer. I'm going to direct my first question to Mr. Boudreau. I thought it was interesting the sort of the exercise you took us through in terms of 2005, Vancouver, challenges you faced, and then working with government authorities to come up with a workaround which thus produced the kiosks, of which we are now very, very familiar, and that you're analogizing sort of where we are with ArriveCAN to sort of the introduction of the kiosks about 14 years ago by my count. Can you just pick up on something that you raised about sort of, you said about working with airports going forward, and just touching upon this, and I'll get to Ms. Pasher as well, but touching on this and how we work with the airlines. So if ArriveCAN now has this advanced declaration option and it speeds up processing times up to 50% for people that choose to use it with the advanced declaration, how do we make sure that enough people are aware of that feature, aware of the time savings it represents, and getting them the ability to have it on their phones and actually accessing Wi-Fi, et cetera, or roaming when they're arriving? One thing that I'm thinking about is just the availability of Wi-Fi when you're on the tarmac, so that you can be doing that instead of filling out those old cumbersome little 5x7 forms that ask you about how much tobacco and alcohol you're bringing into the country. So any thoughts on that?
Yeah, thank you, and through you, Chair, to MP Varani. Thanks for the question. It's funny, I was thinking that too. I always remember being on a plane and fumbling for a pen, or trying to ask your neighbor, can I get a pen, trying to fill out those cards. So I'm glad to see those gone. When it comes to raising awareness for ArriveCAN, so a stat for you, right now we see here at YVR, and I believe it's roughly the same at all Canadian airports, where folks can use the the advanced declaration feature. About 30% of international travelers use that. That's not bad, but we need to maintain that at least and grow that certainly to achieve the benefits. And the benefit for an airline, of course, is I told you about the connections facility. Our airline partners want to see those connections as quickly as possible, and to use a bit of an industry term, turn the plane as quickly as possible. So it's a tremendous benefit for them. So anything that we can do as a combined sector, airlines, airports, government partners, the federal government, yourselves as representatives, to raise awareness of that is important. When it comes to the ability for folks to access Wi-Fi, I mean, when I travel, I was just down in Blaine, Washington, before the federal requirement was lifted, and I was able to access the Wi-Fi at my hotel, use it, quickly file the ArriveCAN declaration, and Bob's your uncle, I was able to get through the border really fast. That's land mode. Here at the air mode, folks are a little more used to filing their customs declarations, and so we believe that through a concerted communications campaign and just building literacy and awareness, we'll be able to keep those numbers up and hopefully grow them.
Okay, thank you very much. If I could turn to Ms. Pasher now. Thank you for your presentation. At the very end, you sort of reiterated some of the themes we heard from Mr. Boudreau, but you also mentioned towards the end that with this opportunity with the advanced declaration, there also comes the need for some modernization of the Customs Act with respect to the legislative authority. I wonder if you could concretize or itemize or specify the types of modernization you'd like to see in the Customs Act, if you had any concrete suggestions. Thanks.
Sure. And just to follow up on that question too, like people can submit the advanced declaration 72 hours in advance, so it doesn't need to be done on the plane. There is time in advance to do that. And right now it's only in place at Toronto Pearson and Vancouver airports, but we want to quickly, move that to other airports across the country and continue this rollout of technology. So the next piece in moving forward, we see ArriveCAN as one element in improving this processing at our airports. We need to modernize the Customs Act. We need to move away from customs officers needing to process every passenger, and we need to get to a place where facial recognition and biometrics, like what you would see in Europe. You go through the e-gate, your picture's taken, you've already been pre-approved. and then you get a go, no go, a green light or a red light. So that's where we need to move in terms of our border modernization in Canada. You know, we've been working on this for over a decade. And now is the time. I think we've seen this summer the challenges that we have in terms of processing when we were in this pandemic space and all the different measures that were thrust upon our airports and the tourism industry. But really, moving forward, air travel is going to continue to grow. It's going to double by 2040, and we need to be ready. We need to be prepared, and I think we only need to look as far as Europe as to how we can do this the right way, and I think CBSA is ready for that. So the next step is our legislation and our regulations and moving forward with that. And a big piece of that is it's not going to be mandatory, it's going to be voluntary. So the people who want to, increase their throughput at the gates can do that, and the people who want to use paper and aren't good with technology can do it the old way. So I think having that option there is also important.
Those comments, I'd just say, I guess, one thing that I'd be concerned about specifically is about if you're using sort of visual technology and facial recognition, how do we ensure that that's applied in a neutral manner and not disproportionately against people that dress a certain way or look a certain way or come from certain countries, right? But that's important commentary. Thank you.
Okay. On to Monsieur Savard Tremblay for 6 minutes, please.
Merci, Madame la
Thank you, Madam Chair, and thank you to all of the witnesses for being here this morning and for your presentations. My first question will be from Dr. Chagla. We know that the use of Arrive Canada is now optional, it's voluntary, but if we have, as is being expected in various northern countries, another vague is announced by public health. Do you feel that we should bring back measures at our borders? And how can we improve ArriveCAN in that case to avoid the problems we've had in the past, and you've talked about those problems, to make sure that we don't have those problems in the future?
Thank you for the question. I mean, I think, and the big thing is we're looking at what's happening even in Europe right now is the virus is continuing to evolve. I think we all agree with that. The pathway for the virus to evolve is more immune evasion, though. So, as we have more populations that are immunized, more populations that have been infected, the virus is going to only gain mutations to then evade that immunity more and more and more, which makes, proof of vaccination even less prioritized in that context, given that the 2 doses, even 3 doses, even 4 doses of vaccinations, there will likely be a breakthrough rate that is significant, any time limited benefit to vaccinations for preventing infection. Still important, again, for severe disease, but the use of vaccinations as a way to separate people at high and low risk is likely coming off the table for a significant amount of time. And so, I would say the use of proof of vaccination to cross a border is again, not going to be something that is going to be effective in the foreseeable future, given the way this virus continues to evolve to be more immune evasive. And again, random testing is probably not going to be a long-term effective strategy, considering that we've done a lot of work in terms of sequencing within our communities to identify variants of concern that have started circulating and will likely start to circulate locally before we even identify they're a problem internationally. And we've done a lot of work with wastewater and other modalities that are passive to actually also integrate that into screening. So, again, the measures I think have left in terms of their benefits, even with the variant X or variant Y coming down the pipeline. And again, I think our focuses should be on vaccinating locally, on getting appropriate treatments locally, on protecting high-risk populations locally, like those in long-term care, those who are immunocompromised, rather than using the border as a tool to mitigate, something that can't really be mitigated at the border.
So in other words, to summarize, we can't improve the measures at the border. They just aren't useful to start with.
Yeah, absolutely. And again, we've seen this across the world. There are, more than 100 countries that have largely, dropped their border restrictions. The last being, New Zealand, who is a country that really did embrace every measure possible to reduce transmission, but recognizing that the measures at the border were not offering significant benefit, were causing significant pandemic disruption, and again, efforts locally were more important. That they also dropped all measures in that context. So I think again, this is where we are in the world, and we're not an outlier in this context.
Do you think in that case that we are now in the endemic phase, that the pandemic is over or imminently over?
We will likely have waves of transmission. How we mitigate that, how we mitigate things like isolation in healthcare, which is a big problem as we move forward, how we mitigate, vaccinations and vaccine fatigue, how we mitigate access to therapeutics. That really is going to define how impactful these waves are going to be. With as much population immunity, though, and through vaccination and through national infection, we have data from the Canadian Immunity Task Force. We have data from British Columbia suggesting 60 to 70% of Canadians have had COVID, and I think we probably are at a point where the disease is causing local transmission, but not necessarily at an emergency phase. And I can say, I practice in an acute care hospital in a large context with many complex patients. In the last 3 to 4 months, there have been between 0 and 5 people in our ICU, and even those, some of them have not been there for primarily COVID reasons. So that acute healthcare demand phase of COVID is probably settling down, and with everything we have, probably won't be a major issue from an intensive care standpoint.
I would like to start my question with you, ladies, and perhaps you can answer or finish your answer after. You have talked about how difficult this has all been for your respective sectors, and have you been able to isolate what was caused by ArriveCAN and what was caused by the other measures? Perhaps I will ask you first. So, Ms. Tasher?
Stages of the pandemic, obviously there were quite different challenges. In the earliest stages, ArriveCAN and the border processing at CBSA was a substantial challenge, both the staff shortage and processing. It took so much additional time at the desk with the border agent to go through this entire process, and there was a lot of duplication. As time moved on and we made the process more efficient, it less so became about that and more so about staffing shortage across the board. So I would say it depends on which stage you're talking about, but it certainly in the early days was a very large issue.
Thank you very much. On to Mr. Bachrach, please, for 6 minutes.
Thank you very much, Madam Chair, and thanks for allowing me to join your committee for a very interesting discussion. It seems like we're talking about two separate aspects of the issue here. We're talking about the appropriateness of the vaccination requirement at our borders, and we're talking about the application of the app. And I want to separate those in my questioning, perhaps starting with the former. And Dr. Chagla, I really appreciate not only your appearance today, but your work over the course of the pandemic. I remember we had you at Transport Committee very early on to talk about some of the quarantine measures. Perhaps I could start with a question just about Canada's COVID outcomes. How has Canada fared in terms of COVID outcomes writ large compared to other G7 countries, and to what do you attribute that?
Yeah, absolutely. So I think this is timely. There's a report, I think, from the Public Health Agency of Canada talking about measures that have helped. I think certainly there were difficult discussions in the first year, and we certainly fared better than many other countries in the world, in Europe and in the United States, in terms of limitation of morbidity and mortality from the disease. It's not to say we didn't have problems. As a clinician, I can remember in the first couple of waves the devastation that we had in long-term care facilities, and that really marking a very vulnerable group in the pandemic that was disproportionately affected in that sense. Similarly, I think with appropriate and rapid access to vaccines and positive public health messaging, as the virus progressed and we were able to get vaccinated, again, that paid dividends on everything. It's interesting when you start looking at the last year of the pandemic, so kind of August 2021 to August 2022, Canada actually fares very, very well compared to other countries, including, places that had significant measures like Hong Kong, which did not vaccinate its elderly appropriately. And once the virus made its way there, despite significant measures in place like masking, like quarantine requirements, like testing at the airport, the cumulative death per capita in the entirety of the pandemic was higher in Hong Kong than Canada. And that really was marked over a couple of months of the pandemic. And so, I think Canada has done very well on this stage. It's hard to dissect exactly what exactly it was, but I think, the cooperation between provincial and federal governments, particularly in the first year and a half of the pandemic, and the widespread availability of vaccinations has largely kind of put us front and center as part of the countries that, tried to balance everything appropriately going forward.
Thank you, Dr. Chagla. Now, when we talk about the border vaccine requirements, if I interpret what you're saying correctly, it seems that the government failed in not adapting its measures in response to changing information about the nature of the pandemic. Is that a fair characterization? And if I could just add on a second question, which is, I assume that you have conversations with folks at PHAC. Has anyone offered you an explanation of why they didn't adapt to changing conditions in a more timely way?
So I'll answer the last question first. I have not had a discussion from the Public Health Agency of Canada and in terms of the rationale for vaccine requirements, especially after I think some of us started questioning exactly what the requirements were. I will say many provinces recognized that proof of vaccination was unlikely outside of, special domains like healthcare and long-term care to offer a significant benefit to the population to reduce transmission, and were largely dropped. And so, I think many provinces started going through this in March and April as Omicron started fading, recognizing that again, that the evidence behind a 2-dose vaccine mandate or a single dose of Johnson & Johnson, which could have been a year plus ago, likely had very little impact on pandemic transmission. And so, again, that was March and April of 2022. We're talking right now in September of 2022 about finally dropping it at the airport and crossing the border. There was a delay to recognize that this was not an effective measure. And again, the impacts of it, I think, were felt across a number of different sectors.
Thanks, Dr. Chagla. I'm going to try to sneak in one more question, perhaps to Mr. Boudreau from YVR. When we talk about the conversation around the app, there was a very loud outcry because of the delays that it was causing, particularly at the land borders, because of accessibility issues for certain demographics. And the call from some quarters was to scrap the app. What I heard in the presentation, both from you and from Ms. Pasher, was that this kind of approach has merit. So when you heard those calls to scrap the app entirely, coming from certain parties, were you concerned that we were going to throw the baby out with the bathwater, so to speak, when it comes to the potential of an app-based approach?
Thanks, MP Bachrach. I think you said something off the top that was really important and important for the community to rehear, which is we need to separate the requirement for vaccine and health information requirements from the use and application of the app itself. The app is going to be the app and the platform it's based on will be an important part of Canada's future modernization of the future border. That there's no doubt about that. We've been without the federal requirements since Saturday only, so we don't have data here at the airport to demonstrate has that improved. But we can see in other jurisdictions where these similar travel measures have been taken away that there's been an improvement. But just to circle back, the app is going to be incredibly important moving forward for Canada's borders, particularly in the air mode.
Thank you very much. On to Mr. Lewis for 5 minutes, please.
Thank you, Madam Chair. Thank you to all the witnesses here today. Just for clarification for everyone, this is a ArriveCan impact study on Canada. So not what it would look like going forward, but what the impact has been on Canadian businesses, on Canadian families, on Canadian workers. That's what this study is all about. So I'm going to stick on those line of questionings, Madam Chair. And I got to say, I'm really proud to be sitting here surrounded by the MP for Niagara, who represents an incredibly busy border crossing, and the MP from Sarnia, who represents an incredibly border crossing, of course, her neighbor as well, that MP, and then, of course, myself, which is right down at the busiest international border crossing in North America in Windsor. And so, perhaps if, to Mr. Bachrach's statement about those that called for scrap the app, well, guilty as charged. Because my office was absolutely inundated with phone calls from businesses, from folks trying to get across, from nurses, from doctors, that literally had glitches, had to spend time in quarantine for no reason other than the failed app itself. So, if it means fighting for people to have some normalcy in their life, then I'm proud to have done that. So my first question, through you, Madam Chair, to Mr. Boudreau, as well as to Ms. Pasher. Last week at committee, we heard from the CBSA officers and, from the union, and they said that, in fact, it completely slowed down people crossing at the border. Would each of you please give us some background to that? And before you do, and I'll probably only have time for 2 questions, I think it's important for me to say one more time, just so that you both know, a story I said last week. And long story short is, a business came in with 4 folks on a private plane. They sat on the apron in Windsor for 2.5 hours because one of the 4 folks had a glitch in their app, not by their own fault. They stayed on their plane and they left and took their business with them. So I would love to hear from both witnesses, please, through you, Madam Chair, about why they believe that this app will actually help.
Sure, Ms. Pasher, maybe I can go first, and if you want to go next.
Sure.
Thank you. Thank you, MP Lewis. It's important to recognize we represent the air mode, and the land border is significantly different than the air border. I'm not an expert in the land border, so I'll leave it to my comments just to the air border. When it comes to the air border, folks are used to filing declarations, are used to doing paperwork, are used to using technology to get through the border process. Like I said in my last answer, we haven't had enough time since the federal restrictions were lifted on October 1st to see a material or to measure rather a difference in processing time. But again, we've seen in other jurisdictions where those similar travel measures were removed, the requirement to submit health information and vaccine verification. We see certainly an increase.
Thank you, sir.
Customs processing.
Thank you very much, sir. Ms. Pasher, please.
I'd just like to echo that same point about, the differentiation of the land border and the air border, because the measures really are different. So I think in terms of the air border, our view is that, if we didn't have the ArriveCan application, we would have been doing all of this manually, and it would have been taking a lot more time. So we did, because of the health measures that were in place and because the government had mandated this, we actually did need some technology application in order to process people. So I think that would be our view in terms of it was needed at the air border because of the pandemic restrictions.
Thank you to both the witnesses. I have 50 seconds left. Through you, Madam Chair, to Mayor Diodati, our mayor in Windsor, Mayor Dilkens, was equally as adamant to get our borders back to some type of normalcy as you were, sir. And just like our casino and our tourism area, been completely gut punched. 30 seconds, Mr. Diodati. So do you feel that the ArriveCan specifically contributed to this decline more so than the vaccination status?
That's a tough one. Both of them were very detrimental to our border, and I did spend a lot of time on the phone with Mayor Dilkens. It was devastating to us. And for us at land border crossings, it was horrible. It made the delays 4 times as long, and there was much less congestion. So it was absolutely the problem.
Please, for 5 minutes.
Thank you, Madam Chair. Madam Chair, we all agree that the health and safety of Canadians is the utmost priority for all of us around here, all political parties, all MPs. And Canada did well compared to other G7 countries, compared to most other countries, because of all the measures that all levels of the government implemented and with the cooperation of all Canadians. I think compared to others, we are in a pretty better shape. So let's recognize that. There's no one single measure that is more important than that. It can be vaccination, it can be social distancing, it can be education, it can be ArriveCAN, it can be putting restrictions on people coming from abroad. All these measures added together for the fantastic results compared to other countries. On ArriveCAN, I did travel twice this summer. First time I used Toronto Airport. I was told while going, there'll be a lot of rush. You have to wait for hours to get in through the security. And while coming back, because of ArriveCAN and other things, there'll be long delays getting out of the airport. But I should tell that this was the fastest time that I spent in the Toronto Airport in July, both while going. I went 4 hours early. I went in there in 20 minutes and then I had to sit there in the terminal for all this time. Coming back, the same thing. It was the fastest thing. And Vancouver Airport, I used Vancouver Airport in August. The same thing there. I'm not saying that others did not face delay, but my personal experience was that ArriveCAN or other measures did not contribute to at least delay from my part. Mr. Pasher, you mentioned that there has been a drop, there's a resistance from maybe I'm paraphrasing you, resistance from international travelers because of various measures. The pandemic has affected businesses throughout the world. Labor shortage has affected businesses throughout the world. The supply chain has affected businesses throughout the world. There are so many things that have affected businesses. My specific question to you is, ArriveCAN, how much did it contribute to the drop in international passengers coming to Canada? ArriveCAN only.
Thank you, Madam Chair, for the question, and thank you. I would say, it really depends on when you're looking at the time frame. Like even when you talked about Pearson and, your experience this July and your experience in Vancouver, the challenges at our airports were more acute in April and May. Okay.
My question is very specific. How much ArriveCAN contributed to the drop in international air passengers?
I don't have a specific number for that, but I would say that ArriveCAN existed because of the vaccine mandate. So the vaccine mandate was an application to facilitate that. So that was, how people were getting through our border. And maybe Ms. Potter has a more definite number on that. Yeah, sure.
And you did mention that ArriveCAN actually ease the process, the delay that were occurring at the airports, correct?
I'm saying the technology application eased it because we had to have the government mandated vaccines, and because the government.
Okay, now that ArriveCAN is not mandatory, do you see a tremendous jump in international air travels during the coming months?
I would say that we're hearing from our business community, the tourism industry, our partners that, U.S. travelers are willing.
Let the witness finish your answer, please.
U.S. travelers are more willing to come to Canada now. They're more willing to consider our destination for events and business events because they don't have the risk of being randomly tested, potentially a positive, and have to quarantine. So because these measures are removed, there's more appetite.
You are going away to other quarantine measures. We are discussing about ArriveCAN. That is the question here. So specifically to ArriveCAN, now that ArriveCAN is no more there, do you think that was a major factor in international air travelers coming in?
A
Yes,
very brief
I
answer.
do. Yes, I do, because ArriveCan was there because of the vaccine mandate, so they're connected, right? So I think you can't just
Okay, I got
yeah.
it.
Well, that's fine, I'm sorry, but your time is up. Mr. Savard Tremblay for 2.5 minutes, please.
Would you like me to repeat the question that I had before? Okay. Well, basically, what you talked to us about the consequences in that presentation. From what you understand and have studied, have you been able to isolate what problems were caused by ArriveCan and what was caused by other problems? So what was the problem specifically?
So I will say that ArriveCan certainly had a huge impact at the land border crossings. This was, crossings where people were not used to having to make any other kind of declaration. They would drive up, they would have a conversation with the Custom Borders agent, they would, show their documentation, whether it was their driver's license coming into Canada or their passport, and so the ArriveCan app and the requirements of the ArriveCan app had a massive effect. And we were seeing, a drop of 50% and more of Americans coming into the country. And the reason was the ArriveCan app. When you look at the other problems with the app, you also had some glitch is with the app, and so you had travelers getting messages telling them that they had to quarantine when they didn't, and so you had travelers out there trying to reroute how they were using the app in order to get away from those quarantine notices. So that's a huge challenge there. When you look at the other restrictions, and certainly the proof of vaccination and the random testing, it really created an uncertainty for international travelers. I mentioned in my opening remarks that international travel this year was down 53%. That's $12 billion of money that didn't come into the country because of travel requirements associated. And as an example, Manette was talking earlier about business events. We had U.S. events coming up to Canada, and on average, we were only getting 60% of attendees. So 40% were staying home, and when they were asked, it was because of the restrictions or the requirements.
Thank you very much. Mr. Bachrach for 2.5 minutes, please.
Thank you, Madam Chair. I'd like to direct my next question to Mayor Diodati. I hope I pronounced your name okay. What you said about your dad really rang true for me. My dad's, you said he's in his 80s and he only has a flip phone. My dad's 75 and he doesn't have any phone. And prior to the pandemic, he was driving down to the United States to visit family quite a bit. And it was just such a hassle for him, the use of the app, that he's avoided those trips since then. And so I'm wondering, now that the app is optional at the land border, do you foresee it continuing? Because I've heard the same stories about border agents essentially having to be IT help desks and that causing long delays at the land borders. With the app optional at the land border, do you see those delays continuing to be a concern? Or do you see a future where we could move forward with some travelers using the app at the land border and others using a more manual process?
Well, thanks for the question. I like the idea that it's optional in the same way that Nexus is, and time will tell. And early on I resisted Nexus, but I became a convert because it definitely made things more efficient when you go to Nexus only lines. So I think if it's done well and they fix the glitches and the problems, and the other thing I'll say about it, and my family, firsthand saw this, the app forces you to lie. So it wants to know your quarantine address. And day trippers that come to Niagara Falls don't have an address because they're going home the same day. So they have to lie. And some of them were putting in the Peace Bridge address, and these are law-abiding citizens, people that, don't want to lie, but they had no choice or not to come here. And then so yes, I think going forward, we will recover. There's no doubt, because resilience is kind of built into our DNA. It seems there's always some kind of a challenge. The question is, how long is it going to take, and how many billions are we going to lose, and how many lives have been disrupted because they can't cross now or they're too old to cross. So I do think having it as an option is good. And if they can fix the glitchiness, and the last part I'll say, along the border, the big challenge is the fact that there's competing cell towers on U.S. and Canadian border, and it's spotty coverage at best. So it's a real challenge when you're on that bridge trying to do anything with your phone.
Okay, thank you very much. Ms. Rood, for 5 minutes, please.
Thank you, Madam Chair, and thank you to the witnesses for being here today. Well, like my colleagues have said before me, I was one of those ones that have been calling for the scrapping of the app for a very long time. Coming from a community that is very close and borders the United States across from Michigan, my office was inundated for months and months and months on a daily basis with dozens of phone calls, emails, senior citizens coming into the office in tears and totally just distraught because they weren't able to cross the border. They didn't have a smartphone, they didn't have a data plan on a phone, and they had been already separated from their loved ones for a couple of years, and they just wanted to get back to life to normal. And this app had devastating impacts on our tourism industry along Lake Huron, also along Mitchell's Bay. If I think about Wallaceburg, I think about Mitchell's Bay, Walpole Island, all the way up the St. Clair River through Sarnia, all the way along southern Lake Huron, where I represent. We didn't have boaters coming in the summertime like we should have because the app was a major impediment to them coming across. You don't have cell phone service necessarily out on the lake. People didn't have cell phones, like I said, with data when they're crossing the land border. So it was a very big series of frustrations for a lot of the people in Lambton, Kent, Middlesex, and our businesses. I witnessed many businesses empty at night, evenings on the streets of Grand Bend, which would be a booming tourist town full of people from Michigan, much like Niagara Falls, and there just wasn't the people there. And so, Mayor, I can sympathize with you for what your city has gone through. I witnessed the border lineups that were non-existent coming across through New York, going to from Buffalo over to Niagara Falls, and when there were only a few cars, it took an hour because people were having issues with the app, and the frustration is real. So I guess, I'd like to ask Ms. Potter a question. I know we've heard that the Canadian Federation of Independent Business is saying that, approximately 1 in 6 businesses are considering closing their doors even still because of the devastating impacts of ArriveCAN. So I'm just wondering if you could speak to any other instances or what you've seen from small businesses and the impacts of this app, and also just what the cost may have been to the small business industry, which is what most of our tourist towns are made up of, are very small independent businesses.
So for those businesses that are in border towns, what they will remember, what they're still stinging from, is the impact of the passport requirement post 9/11. Canadians are much more adaptable to new technologies and new requirements than Americans are. And I say that, with a large American family of my own. But the fact of the matter is, having a passport to go back into the United States prevented many Americans from traveling for 10 years. It took us 10 years to see the number of Americans coming across the border into our border towns and enjoying our retailers, enjoying our tourism businesses. 10 years. And this is what businesses are afraid of. They are afraid that they are going to see another 10-year lag, and they just can't afford that. And when you add that on top of the additional debt burden that they've taken on because of trying to stay alive during the pandemic years and trying to keep their businesses afloat, we're just adding an increased burden to these businesses. And so a lot of them are looking at it and saying, this is my future, this is my retirement, is this the way I'm going to be, am I going to be able to continue to support my family? And they're making the decision to close and do something else instead.
And that's very troubling to hear that. And I've seen businesses shut their doors in many of my communities because of that. And I'm just wondering, maybe Mr. Mayor, you can help with this, considering that you're a border town. What would you like to see the federal government do to help bring back tourists from, especially the United States, because there is a hesitancy from a lot of U.S. residents still to come over to Canada, and we've seen the morale drop, and people don't want to come to Canada. What would you suggest? And I know we only have about 30 seconds, so.
I think we need a major advertising campaign to the U.S. If us now removing restrictions is the best kept secret, it's not going to help us and it's going to delay the recovery. So we need a major advertising campaign targeting the U.S. markets and international. Let them know we're once again open for business.
Thank you very much. Mr. Miao, for 5 minutes, please.
Thank you, Madam Chair, and thank you for all the witnesses to attending today's important study on this impact of ArriveCAN. First, I'd like to acknowledge Mr. Boudreau, which is done a great job with YVR, as I do travel there quite often nowadays between YVR and Ottawa. I want to direct this following questions to you. As we all know, many businesses globally and locally are facing tremendous challenge during the global pandemic, ranging from interrupted production, supply chain disruption, to rapid shift in demands, staff shortages, elevated commodity price. And despite the significant challenges, Canada's two-way trade in goods and services rose by 14.1% in 2021 and reached a new record high of 1.5 trillion. This is a testament to the adaptability and resilience of Canadian businesses, workers, and entrepreneurs. And given that other Canadian sectors and Canadian overall trade is improving, have you experienced an increase in flight related to trade at the Vancouver airport? And how does that affect based on the impacts of ArriveCAN application?
Thank you, and through you, Madam Chair, to MP Mao. I appreciate the compliments. I am but an avatar for the more than 24,000 people that work here at YVR every day and directly contribute to a positive experience for our travelers. So thank you for that on behalf of everybody. In terms of trade, historically for the airport, cargo generally does come in the belly of passenger aircraft. Before the pandemic, it was about 70% of cargo and trade was enabled through belly cargo, we call it here. That's changing, and that's changing quite fundamentally because of the impacts of the pandemic. Of course, there weren't as many passengers, so those planes were coming in full of boxes and goods, and I'm sure folks have seen lots of pictures there. And then, of course, here on the West Coast, we experienced the tremendous climate-fueled weather disaster that wreaked havoc on our roads and rail, and so the air mode was able to pick up a little bit of the slack. We actually see a tremendous opportunity, and as such are investing a significant amount of money to expand our cargo operations here at the airport in support of Canada's economy and in support of Canadian cargo operators, and that's important. The challenge with the vaccination and health information mandate that had to be submitted through ArriveCAN, any delays that would have impacted a connection at any point in an aircraft's journey, and that may not have been at YVR, that could have been at another airport, it could have been at an international airport, impacts the ability of those goods to also arrive on time, and so it exacerbates some of the challenges you mentioned there in your opening remarks around supply chain challenges. So the faster that our sector can get back to what we once were, which was essentially operating like a Swiss watch, where we were moving just-in-time supply chains expertly, both passengers, bags, as well as packages. The sooner we can get back to there, the better for everybody.
And you mentioned the application is an important part of modernizing the future of traveling. And do you see, or is there any suggestion you see that we can better improve this application to make it more convenient for international travel or even local travelers on their experience through not just YVR Airport, but any international airport across Canada?
I think, again, through you, Madam Chair, to MP Mao, I think there'll be a lot of lessons learned about how the application was rolled out. It was rolled out rather quickly through a pandemic, and so, maybe some of the testing that would have normally been done didn't happen. Certainly, there's a great discussion to be had about how can we overall, whenever we're launching new technology here in Canada, how can we ensure accessibility is front and center. Here at YVR, when we're developing technology, we develop it with security and privacy by design. I have no doubt that the CBSA did not do the same with ArriveCAN, but that's important too. And then fundamentally, it comes down to everyone has to sort of row the boat together and help folks understand and build literacy about how to use these applications. I use the example of a multi-generational family arriving at YVR, and with the combination of the folks that are a little more tech savvy using ArriveCAN in advance to then be able to help maybe their family members who aren't as tech savvy, like Mr. Bacharach and like Mayor Diodata. I also have parents in their 70s with questionable tech skills, and so I often operate as a tech help desk. But that's really important for folks. And when they come through the air mode, that utilization of ultra-efficient technology with the ability for border guards to see non-trusted and potentially riskier travelers to do the job that they need to do, which is protect our borders, that's going to be critical in the system.
Thank you very much. On to Ms. Gladue for 5 minutes.
Thank you, Chair, and thank you to the witnesses for being here today. I'm going to start off with the question for the mayor. The Blue Water Bridge in my riding saw many of the same issues that you've detailed. I mean, we saw delays 4 times as great and more, and many individuals that were fined quarantined even though they were fully vaccinated and asymptomatic, seniors calling my office crying, many people feeling quite abused. But at the end of the day, it seems to me that the mandatory use of ArriveCAN was discriminatory to seniors that weren't tech savvy and people that didn't have a smartphone. Would you agree with that?
100%. I was inundated with calls from seniors all over the region and in different ridings and municipalities as well, because I was a voice defending their concerns. And there was no question at all. They definitely felt targeted throughout this. They felt helpless. And the one gentleman said, I feel stranded. I haven't been able to visit my family. He was very, very frustrated and hurt.
Yes, we had the same thing. Many people that, of course, in a border town used to go across every day shopping, visiting family. Many people have partners and are, relationships that were damaged by this long border barrier. One of the things that we saw as well was many people that crossed the border and had filled out their ArriveCAN, they would get emails 2 or 3 days after, like nobody would say anything to them at the border, but 2 or 3 days later, they would get emails saying that they had missed their first test and they should be quarantining. Meanwhile, they'd been 3 days, wandering around the community because nobody told them anything about it. And then they were threatened with fines. Did you have any things like that happening in your riding?
Yeah, daily. And that's why people were so concerned and worried. And they weren't little fines. My own brother was visiting his son going to school in the U.S. And when they came across the border, for some reason, the results, they paid for their PCR test. It didn't come through. And they were threatened with $5,000 fines each for him and for my sister-in-law. So there was a lot of people, and imagine a lot of seniors get very worried. So what do? They avoid it. So it's like their freedom was taken away from them for a few years. So I feel bad for those people, but I would hear those kind of horror stories on a regular basis from tourists and locals alike. I was inundated, and they kept saying, is anybody listening? Why aren't they reacting? So yes.
Thank you for that. I have some questions for Ms. Potter. I have a lot of relatives in the U.S., and I would agree with your statement that many Americans were totally unaware of the requirement for ArriveCAN. What should we have done, or what could we do to make international travelers, especially the U.S., that's such an important partner for us, aware of the requirement?
Thank you for the question, and through the chair. I would agree with Mayor Diodati's recommendation on we need to get the word out. And so I'm looking at organizations like Destination Canada, and to the provincial and territorial tourism marketing agencies, that they're going to need to incorporate this kind of information in their campaigns to the U.S. in order for us to try and overcome what has been a barrier to Americans coming across into Canada.
And a question for Ms. Pasher about the international travelers coming in and the impact of the ArriveCAN app. Can you talk a little bit more? You had some information there about the drop-off in international folks due to the ArriveCAN. I'd like to hear more about that.
Yeah, I think the vaccine requirement and the pandemic measures which were facilitated through the ArriveCAN app posed a barrier to travel. I mean, we've heard numerous examples, here today, but also places like Whistler, skiing, and, we heard that it's mainly U.S. travelers, and they certainly saw the impact of that. So I think having these pandemic measures in place had an impact on our tourism industry and our airports and our airline partners.
I'll just say thank you to the witnesses, and I'm glad to see that ArriveCAN is gone, and I hope it doesn't come back.
Thank you. Thank you very much. Point's been noted. Mr. Raya, for 5 minutes, please.
Thank you, Madam Chair. The pandemic has been quite frustrating to all, especially for businesses. Now that pandemic coupled with, maybe due to pandemic, the supply chain problems, then the related labor shortages, all these have contributed to a lot of problems, especially for the tourism industry too. I have traveled within Canada probably more, first time since the last 3-4 years. I've stayed in Montreal, Toronto, Vancouver, and other places. Getting a hotel room is quite difficult, and they're bloody expensive, very expensive. Mr. Potter, nice seeing you again twice in 24 hours. Yeah. You mentioned there's a drop of 15 or 50% for people crossing the border by car. How much? 50%. 50.
Yes.
Okay. Then you also mentioned in your opening statement that international travelers tend to stay longer and spend more than the domestic travelers.
Yes.
Which category do you think spend more? Is it the people crossing by on land border or the international air travelers from Europe, Asia, and other places?
Well, we certainly know that the farther somebody travels to Canada, the longer they stay and the more that they spend.
So basically, it's the air travelers tend to stay for longer period and tend to. Okay. Again, my question to you is, the drop in business from international air travels, how much of that is related only to ArriveCAN?
So that is a really hard question to answer. What we know is that we have lost 53% of international visitation into Canada.
I understand, because the people who are frustrated due to everything related to this pandemic, labor shortages, supply chain problems, the inflation, and the people even opposed to vaccination, they're all zeroing on one thing, ArriveCAN. So it's very easy to take out the frustration on something else, and now here is ArriveCAN, or take it out. Everything will go back to normal. Is that the case?
So I would suggest that we were not zeroing in on just one thing.
Exactly.
And that we were,
the point
that
of this
ArriveCAN was
study,
one of.
Sorry, the point of this committee, this study is on ArriveCAN.
Okay.
So again, my question is, how much did ArriveCAN contribute the drop in international air travelers?
And again, I don't have that number.
Okay. Now, domestic tourism, it is increasing. It's a good thing in my view. I'm from Ottawa. I was on the board of Invest Ottawa. People think it's a government town. We want to change it. The technology sector here is one of the biggest, probably the biggest in Canada, surprising to many other people. And the second thing we have, in addition to technology sector, we have identified tourism. Ottawa is a beautiful place. National Capital Region is a beautiful place. We want domestic tourism to improve. And has this contributed, the problems with international travel, has it contributed to the increase in domestic tourism?
So certainly we are seeing domestic tourism come back. And come back faster than international travel. But it is still down across the country by about 16%. One of the things that we found is that when our borders were closed, Canadians were exploring their own country and discovering places within the country that they didn't really realize. And so instead of, saying, oh, I want to go to hike to base camp at Mount Everest, I got to go and hike in Banff as an example, and they were saying how great that was. But Canadians also like to get on a plane and go elsewhere, and so we are
That's
still,
okay.
as much as domestic travel has rebounded over the last year and a half. We are also anticipating that we will start to see that travel deficit come back up again as Canadians get on planes and go elsewhere.
You said that.
You have 20 seconds left.
Okay, quickly. Domestic tourism, you said it has come down by 16%. Why is it very difficult to get a hotel room?
So, contrary to popular belief, hotels aren't full 100% of the rooms that they have. They're full to the capacity in which they can service the customers that are there. And so, a hotel may be only operating at 60 or 70%, and that's why it's been very difficult to get bookings in some parts of the country.
Thank you very much. Mr. Savard-Tremblay for 2.5 minutes, please.
Thank you. Well, we know, I don't know which witness said this, but was saying that we needed to look ahead to be able to lift the restrictions. So I wish I could remember who said that, because that's the person I would really like to address my question to. So my question would be, so if we want to promote the use of ArriveCAN as a voluntary tool, is it useful enough to promote it? So whoever would like to answer that question, please go ahead.
I think we need to separate, promoting our tourism industry and that Canada is open for business and advocating to travelers this tool, this application that can help them fill out a declaration in advance and help with processing at our airport. So I do believe that there's messaging that we can do with our government agencies to support them as airports and airlines. But I think, the promotion of Canada is separate from that.
And I'll jump in and say that it's not helpful at land border crossings. I can't speak for airports, but I can tell you the majority of people come into this country through land border crossings, and it is not helpful at land border crossings.
Only one tool, one version of the tool. It's not helpful for, the multiple languages that we encounter with international visitors coming in from an accessibility standpoint, whether it's from seniors or other use. So always having an alternative method of communicating and sharing the information that's being asked for is something that we need to have, regardless of which way we go forward.
Thank you very much. You have 18 seconds.
Je n'ai plus de questions. I don't have any more questions. Thank you.
Correct for 2.5 minutes.
Thank you, Madam Chair. And maybe I'll just ask Ms. Potter a follow-up question on her last point, because she said, if I understand you correctly, having an alternative option for those people who struggle with the technology or don't have access to the technology would have avoided a lot of the problems that we saw both at land borders and air borders. I appreciate that this is sort of a retrospective on how things could have been done better. And separate from the question of whether the vaccine requirement was appropriate, given that the government put the vaccine requirement in place at the borders, do you feel that having the app as an option as opposed to a requirement would have avoided a lot of the challenges we saw?
I certainly do. And I think that if you look at how we process people through our borders, the ability to make that declaration, verbally, much like we've been doing for years at the land borders, coming into the country and declaring verbally how much you are bringing back into the country, this is a process that was put in practice and well used. By mandating people to use a tool that they weren't familiar with, a tool that took some time to fill out, and caused a massive delay at border crossings into the country, it really had a reputational damage on Canada's brand. And that is something that will take time for us to undo as an industry.
Madam Chair, can I ask one very brief question of Mr. Boudreau? Again, I understand this is a bit of a hypothetical exercise, but if we separate the two aspects of this issue and we say, setting aside the questions around the necessity of the vaccine mandate at the borders, if we went back in time and didn't have the ArriveCan app at airports, would the delays have been better or worse than what we saw using the app? Because, I'm assuming that border agents would have had to look at vaccine verification from all sorts of different countries, and that in itself potentially could have caused delays. Can you speculate a bit on what the situation would have looked like without the app, but with the vaccine requirement?
Thanks, and through you, Madam Chair. I won't speculate, but I'll go back to the data, and certainly at the beginning of the pandemic, when we didn't have another way to verify, or when the border agents didn't, and they were doing it on paper with as well as officials from Public Health Agency, it was slower on the air border.
2 minutes. Okay, thank you very much, Mr. Baldinelli, for 2 minutes.
Thank you, Madam Chair. And I just want to follow up with Ms. Potter. Recently, Statistics Canada in September, they released their leading indicators on tourism activity. And it showed for the month of August about 1.1 million land border crossings from the U.S. into Canada, so about still 50% down. And I want to touch upon quickly, if we could, what it is that we need to do with Destination Canada to begin that process of marketing into the United States. Now, did you find that Destination Canada funding this year was similar to past? Was there additional marketing funds put in to help advertise into the United States? And what do you recommend going forward? Is there a budget number that you would like to see?
So we are in the process of finalizing our budget recommendations going forward, but certainly we would like to see Destination Canada receive some additional funds specifically to re-engage the U.S. Traveler, whether that's a day traveler coming across, a leisure traveler, or a business traveler. We need to regain the confidence of the American market that Canada is a safe place to travel to. Not just a safe place, but an easy place to travel to, and that they won't get
Thank you.
caught
And
up.
quickly to Mayor Diodati, just following up on Destination Canada. For many years, I believe at 11, we used to have a representative sitting on the board of directors of Destination Canada. Being the #1 leisure tourism destination in all of Canada, I would expect, and hopefully you agree, that Niagara Falls deserves a seat on that board. Do you agree?
100% agree with that. I appreciate you bringing that forward, and I hope there'll be consideration. Our last member, Dragan Matovic, is no longer there, and we definitely would like representation there, and I think it makes a lot of sense.
All right, I want to thank the witnesses very much for your time and attention on this important issue for us.
you.